delayed onset muscle soreness. What is delayed onset muscle soreness? So delayed onset muscle soreness, or DOMS, is defined as muscle soreness felt a day or two after a heavy bout of exercise. DOMS can vary from a slight muscle stiffness to severe debilitating pain that restricts movement. One of the main causes of it, or several of the main causes of it, it can be caused by performing an excessive number of or abnormally high intensity of a type of exercise. The use of eccentric contractions of the muscle is the main cause of the condition. So an eccentric exercise such as Nordic hamstring curl could be a cause of it. It is also caused by a person being unaccustomed to performing such eccentric muscle contractions, which is why DOMS often occurs when people first begin to exercise. The symptoms of DOMS are usually felt as a dull, aching pain in the affected muscles where they are often stretched and placed under pressure. So if they were doing the Nordic hamstring curl, their affected muscle would be the hamstring. When touched, the muscle can be tender or feel inflamed. It can also feel stiff to the person affected by DOMS. When at rest, the muscle feels fine without lingering symptoms of DOMS. DOMS symptoms show up after an exercise is completed and are not associated with any symptoms that may show up during the exercise. That would be known as acute muscle soreness, which is pain felt during and immediately after exercise. It usually dissipates within a few hours after exercise. DOMS is usually felt between at a peak of 24 to 72 hours. So symptoms of DOMS should disappear after 72 hours on their own. If treatment is desired to help it speed up the recovery, there are several ways to relieve the symptoms of DOMS. For instance, there's cold therapy, anti-inflammatories, heat therapy, foam rolling, and compression, which we'll dive deeper into. So cold therapy. Cold therapy is effective at reducing swelling, soreness, and pain when used immediately after exercise. A specific source of cold therapy that has been studied is cryotherapy. So a study using cryotherapy interventions include ice massage, ice bag application, and cold water immersions of the limbs. Exercise-induced muscle damage was induced using high-velocity eccentric exercise protocols, repeated stretch shortening cycle exercises, and or intense training. The results found with the cryotherapy and the other forms of ice application showed positive results toward the symptoms of DOMS. Showed decreases in selected pro and anti-inflammatory cytokines, anabolic mediators, and metabolic markers were also reported. However, cryotherapy did not affect post-exercise swelling or myoglobin levels. Anti-inflammatory medications, so non-steroidal anti-inflammatory medications such as aspirin, ibuprofen, naproxen sodium can be taken to reduce muscle soreness and pain. However, this should be used with great caution in treating the symptoms of DOMS. One study has shown that short-term advantages after treatment with anti-inflammatories might be followed by negative long-term effects that can slow the healing process of DOMS. So absolutely take if you're in dire pain. Heat therapy. So heat therapy is another form of therapy that is best used for acute conditions like DOMS. Heat therapy works to alleviate pain by opening blood vessels, which increase the blood flow. A study showed that there was a benefit of applying heat 24 hours after exercise, but to a smaller extent. The conclusion was low-level continuous heat wraps left for 8 hours just after heavy exercise reduced DOMS in the population tested, as assessed by the subjective and objective measures. Although cold is commonly used after heavy exercise to reduce soreness, heat applied just after exercise seems effective in reducing soreness. Unlike cold, it increases flexibility of the tissue and the tissue blood flow. Foam rolling. So foam rolling is a type of self-administered massage that can help relieve muscle tension and soreness. It works by breaking down scar tissue, loosening tissue adhesions, and stretching the muscles and tendons. Since the early 2000s, a form of self-administered sports massage has developed using foam rollers to relieve the discomfort of DOMS and general muscle stiffness. Like a sports massage directed by therapists, the foam roller breaks down scar tissues, loosens tissue adhesions, and stretches muscles and tendons. As of 2016, the several preliminary studies of small groups of collegiate athletes indicate that rollers are effective in reducing DOMS. So just taking 10 to 15 minutes before and after could make the biggest difference. Compression. Compression is a form of recovery that can increase blood flow to the site of injury after helping it heal faster. A study was done to show the effects of compression garments on recovery following drastic exercise or damaging exercise. A systematic review and meta-analysis were conducted using studies that evaluated the efficacy of compression garments on measures of DOMS. These results indicate that compression garments are effective in enhancing recovery from muscle damage. Prevention of DOMS. So DOMS can be minimized or even prevented by beginning a new exercise program or routine slowly and increasing its intensity gradually over time. It is also highly recommended to have a warm-up phase before any exercise and a cool-down phase after such a routine. DOMS can also be prevented by proper supplementation. So a warm-up / cool-down sequence are important to athletes' performance as athletes' abilities in the sport itself. The most common type of DOMS is experienced when the athlete has participated vigorously in new or unaccustomed activity. The risk of DOMS can be reduced through the implementation of a focused warm-up and a cool-down regimen. So doing some dynamic stretches before, and then maybe doing some static stretches after, maybe doing like a light run on the treadmill or the track. Supplementation. So herbs and natural supplements play a big part in preventing DOMS. Previous studies have documented that efficacy herbal therapies to treat pain, inflammation, as well as laboratory and clinical side effects of DOMS. The use of herbs and DOMS seems safer and has a low side effect than pharmacotherapy type drugs. The study was aimed to examine the preventative effects of saffron and endophthalmos after one session of eccentric exercise. Results showed that when using the saffron over 10 days, it prevented and alleviated the symptoms of DOMS. So, in conclusion, although there are a lot of ways to treat and prevent DOMS, there are also things that have been proven not to work. Some things that should be looked into is electrical stimulation, stretching, acupuncture, and nutrition as possible treatments and preventions. These just have limited research. There's not a lot of scientific proof on these yet. Most of the treatments are not for everyone, so it is up to the person to experiment and find out the best treatment for themselves. Even though it may not be fully researched, that does not mean it will work for them. There's still lots of research that